Welcome to The Explainer. Today, we're diving into something that affects literally every single one of us, yet, it's often wrapped up in so much stigma and misconception. We're talking about aging, specifically redesigning the quality of life for folks over 80. And we're going to completely shift the paradigm today. We aren't just looking at how to manage a decline, no way. We're exploring how to actively, intentionally design a fulfilling, independent, and vibrant future for the elderly. We'll be pulling from some truly incredible research from the cutting-edge science of vascular health all the way to the integration of artificial intelligence in care. It's the whole shebang, all to build a holistic framework for aging beautifully.
Okay, let's dive into this. What if 80 is literally just a number? Think about it. When we hear someone is 80 years old, society tends to hand us this pre-packaged box of expectations, right? Expectations about their fragility, their cognitive state, their limitations. But the science of gerontology, which is the study of aging, tells us a completely different story. It tells us that this chronological timestamp on a birth certificate, it actually gives us very little useful information about how capable or healthy a person truly is.
To really get this, we have to separate two critical concepts. First, you've got chronological age, which is simply what's printed on your ID. And then there's biological age, which is the actual physical condition of your vascular health and organ function. According to Professor Dr. Ahmet Akgul, who's a leading specialist in gerontology and cardiovascular disease, just looking at the calendar is totally the wrong approach. Biological aging is the true metric. As we get older, the real story of our health is written right there in our blood vessels.
Get this, there can be up to a 20-year gap between a person's chronological age and their biological age. Think about that for a second. 20 years. That is nearly a quarter of a lifetime. A person might be 80 years old according to their passport, sure, but if they follow the rules of healthy aging, maintain their physical health, and optimize their environment, well, their biological age, their blood vessel age, could be functioning like that of a 60-year-old. We actually have an incredible amount of agency over this gap.
To understand exactly how we control that gap, here is our roadmap for today's explainer. 1. Beyond age, the biological clock. 2. The hidden epidemic, loneliness. 3. Safety first, ergonomics and aging in place. And finally, 4. AI and social robots. Let's get right into it.
Starting with Section 1, Beyond age, the biological clock. When we talk about gerontology, we really need to reframe it in our minds. It's not just the study of getting old, it is the comprehensive science of aging healthily. Now that encompasses biological, economic, social, and environmental factors. But the bedrock of it all, that's our physical biology.
And this brilliantly illustrates our main point here. Biological aging equals vascular aging. As Professor Agel points out, the breakdown in the function of our organs, from our heart all the way to our skin, is directly related to the aging of the tiny capillary vessels feeding those organs. If you keep the vascular system healthy, you keep the organs healthy. This degradation isn't just some inevitable curse of the calendar, it's a vascular process, and it's one we can actively monitor and manage.
But of course, biological health doesn't just exist in a vacuum, which brings us to Section 2, the hidden epidemic, loneliness. You could have a perfectly healthy heart and vascular system, and it can still be absolutely devastated by emotional distress. And for the elderly, the most pervasive, silent distress they face is, without a doubt, loneliness.
Check out this fascinating data from a study by Suleiman Demirel University. They looked at elderly individuals living at home, breaking down who is most vulnerable to loneliness and a lower life satisfaction. The findings? Pretty surprising. They found higher levels of loneliness among elderly men, those who are actually married, and those with lower education levels. Plus, life satisfaction took a massive nosedive for folks with low income, no social security, and, crucially, those who do not use social media. Digital connectivity is literally proving to be a vital lifeline for older adults.
So, what does this all mean? The core takeaway here is that loneliness for those over 80 isn't just a fleeting feeling of being sad. Emotional and social loneliness directly correlate with a drastic, measurable drop in life satisfaction. It is a full-blown structural epidemic. If we genuinely want to improve biological health and expand that 20-year age gap we talked about earlier, we absolutely have to actively design social support and digital inclusion right into the daily lives of our elderly population. Which perfectly transitions us to Section 3, Safety First, Ergonomics and Aging in Place. We know we need vascular health, and we know we need social connection. But physical frailty and isolation, they're often made way worse by the actual homes the elderly live in. We have to intelligently adapt these spaces.
This brings us to a totally crucial concept known as aging in place. It's a principle heavily supported by guidelines from the Turkish Ministry of Family and Social Services. Basically, aging in place means modifying the home environment so a senior can keep living independently, safely, and comfortably in their own home as their physical abilities change, rather than just immediately moving them into a care facility.
Now, what's really interesting about this slide is how simple yet absolutely life-saving these architectural interventions are. High fall risks are a massive, massive threat to the elderly. Bone fragility makes simple home accidents devastating, so spaces have to be optimized. We're talking non-slip floors and mats, balanced lighting to compensate for age-related vision changes and cut down on nighttime falls, totally clearing corridors of any tripping hazards, and installing sturdy grab bars and ramps where they're needed most. These aren't just cute home renovations, they are essential safety prescriptions.
Taking a slightly more scientific look at it, this ergonomic physical requirements matrix maps out how spatial layout directly ties to user health and safety. It shows that visual comfort, thermal comfort, and auditory comfort, they all must be engineered right into a living space. As hearing and vision naturally decline and reaction times slow down, the home has to compensate. Proper natural and artificial lighting, effective heating, and good acoustic treatments, they aren't luxury add-ons, they're ergonomic requirements that allow an 80-year-old to navigate their own house without physical strain or anxiety.
But here is the catch. An accessible home should never, ever feel like a sterile hospital ward. This second matrix highlights the psychosocial needs of interior design. A home still has to provide privacy, aesthetic beauty, and spaces specifically designed to foster social relationships. Remember that loneliness epidemic we just covered? If a home is designed solely for physical safety, but ends up isolating an elderly person in a back room away from all the family activity, it completely fails. The layout must invite social connection while keeping the individual's dignity and independence intact.
A perfect everyday example of blending these needs is something as simple as a chair. According to research backed by TÜBİTAK on the anthropometric data of elderly individuals in Turkey, ergonomic seating is absolutely crucial for independence. Because the elderly spend more time indoors, watching TV, reading, they need furniture that properly supports their whole body weight. Reducing the physical strain during that repetitive daily sitting and standing protects fragile bones and muscles, which directly boosts their independence and overall quality of life.
All right, moving to our fourth and perhaps most futuristic pillar, Section 4, AI and social robots. We've covered biology, psychology, and the physical home, but what happens when human care and those environmental adaptations just need an extra boost? Well, we bring in a cutting-edge technological support layer.
We are officially entering the era of gerontechnology. This is an amazing interdisciplinary field that combines gerontology with technology to create environments and systems designed specifically to support our aging population. Think smart homes, interconnected sensor networks, and highly specialized artificial intelligence.
And honestly, we desperately need this tech, all because of one staggering number: 761 million. There are currently over 761 million people over the age of 65 globally today, and that number is just skyrocketing. The plain truth is, human capacity to provide full-time, round-the-clock care is simply being outpaced by this demographic shift. Technological solutions aren't just cool science fiction anymore, they are an absolute necessity for sustainable care.
So the crucial point is just how incredibly effective this technology has become. Look at these clinical diagnosis accuracy rates from recent studies. They are staggering. Deep learning algorithms are predicting and diagnosing critical conditions with mind-blowing precision. 90% accuracy for dementia, 85% for knee osteoarthritis, and 91% for cardiovascular diseases. By catching these issues early, AI is quickly becoming the ultimate preventative care assistant. But it goes way beyond just running diagnostics. Technology is stepping in for emotional support too. Social robots, like the robotic seal Paro or Lovat, are actively being integrated into care plans. And no, this isn't some dystopian future where we abandon our grandparents to machines. The integration is actually step-by-step. First, you introduce the robot to provide cognitive and sensory stimulation. Second, studies show this leads to observably decreased agitation and loneliness, especially in Alzheimer's and dementia patients. And third, it critically relieves the immense burnout experienced by human caregivers.
And that brings us to a truly beautiful truth at the core of all this research. Technology doesn't replace human love. Instead, it absorbs the heavy labor so we can actually focus on human connection. A robot cannot and will not replicate the meaning of family bonds. What AI and social robots do is take on the mechanical, exhausting tasks of continuous monitoring and physical assistance. By doing that, they leave adult children, nurses, and caregivers with the actual energy and time to sit down, hold their loved one's hand, and just be fully present.
Which leaves us with this final thought. Aging is not some passive decline we just have to quietly accept. From taking control of our vascular health, to ergonomically redesigning our living spaces to prevent falls, to embracing AI and robotics to support our caregivers, we have the tools to completely transform what it means to be over 80. So, taking everything we've explored today, how will you redesign the future for your aging loved ones, or for that matter, for yourself?